And the Veterans Affairs Clinic in Harlingen shakes off a title that labeled it among the worst in the nation.
It is no longer considered high risk. Channel 5's Trayson Bragg is live with details on the changes that made the difference. Trayson.
That's right. The prior troubles at our local VA are well documented. Ask any veteran in the area. They aren't shy about sharing bad experiences. However, the acting chief of staff tells us this week's announcement is a step in the right direction. A lifetime member of the 101st Airborne Division of the U.S. Army, Hector Mercado says during the Vietnam War, he risked his life saving American lives as a medic. Mercado says as he's gotten older, he spends more and more time at the VA.
I go to 2 different doctors.
Mercado tells us his dealings with the local VA aren't always positive. His biggest issue, trying to get a VA staff member on the phone.
I've had to go out there to the VA clinic and drop them a note and tell them, look, I tell the clerk, can you give this to the nurse or the doctor because I'm out of medication. You guys don't answer the phone.
In recent years, grades of our local VA, Texas Valley Coastal Bend Health System, were less than favorable. The health system was rated 1 star. It was also one of 15 VA health systems classified as high risk last year. This week, that classification was lifted. The system's acting deputy chief of staff, Dr. Jennifer Wood, says that's in large part to addressing problems like Mercado's.
That's an area we get evaluated on, how well we do receiving calls from veterans, answering the phone quickly, dispositioning those calls with 1-call resolution ideally.
Wood explains the improvements to the clinic's call center are the result of a task force assembled to improve the level of care provided by the health system. Wood says the task force also improved the level of care provided to patients suffering from
things like COPD, diabetes, dehydration. Those are conditions that can be successfully managed on an outpatient basis, and if you do well at that, you can prevent hospitalizations.
That's an improvement Wood says also contributed to the removal of the high-risk title. She tells us from here, the health system plans to continue to improve the care they provide to veterans.
Well, I want to see it come to fruition. I'd like to see that happen.
Wood adds the new star rankings are released next month. She's hoping the health system improves to a 2- or 3-star rating. In the newsroom, Trayson Bragg, Channel 5 News at 10.